Incidents involving infectious diseases or toxins pose a high degree of danger to you and your community. You must be able to recognize the hazards in these incidents and take appropriate action quickly. In this program, you have seen infectious diseases described and how they can be transmitted between responders and patients. You have seen different kinds of poisoning, the 4 routes of exposure into the human body, and how to contact a poison control center. You have seen the common sources of carbon monoxide poisoning and how to assess and manage it. And you have seen the 3 routes of exposure for nerve agents, the signs and symptoms of nerve agent poisoning, and how to manage a patient who has experienced nerve agent exposure. The potential impact on your jurisdiction of an infectious disease or chemical release is significant. By understanding the risks of such an incident and preparing for it ahead of time, you can help minimize the impact on your community.